it too. Hi, we're doing something different today. We have 2 events happening this week at mHUB for our MedTech accelerator. They're demo days, which is the culmination of their 6-month program. Super exciting. They're in the shop demoing their hardtech medical device products. And so we're gonna pop around. They're in the middle of conversations with investor audience that we invited here today. So I'm not sure that we'll be able to talk to any of them, but we can just sneak in and kind of see some of the products that are developed under the mHUB roof through the accelerator. So let's see what they're up to. Here we have Bionode, Smet. Hi, great job today. Can you tell us a little bit about the product and what you guys have worked on at the accelerator?
Absolutely. Bionode is a clinical stage company that is developing a remote solution to treat glaucoma. At Bionode, at mHUB, we have really reached a stage where we had this original device, which is used in clinical trials, where we could modulate all the parameters and brought it into this small form factor. It will fit on the side of the glasses and can be used. It's a total novel way of solving the issue of high pressure in glaucoma, and has been mHUB and its community has been a great help in making this happen.
Cool, thanks Matt, appreciate it.
Thank you.
Okay, so now we're going to talk to Aqua Band's Manav. Hey.
Hey, how's it going?
Good, thanks. Can you tell us a little bit about your product and what you've been working on?
Yeah, definitely. So we're developing non-invasive wearable devices for patients with Parkinson's and essential tremor to help alleviate their hand tremors. The inspiration for this was my grandmother. She experienced essential tremor about 5 years ago, made simple tasks very difficult for her, like eating, writing, and dressing. And so what I really wanted to do was build some kind of non-invasive wearable that could help alleviate these tremors and restore, in some sense, her level of independence. And so happy to show you exactly what we've been working on. So if this is kind of what a baseline tremor looks like, if they experience tremor within their particular range, we're able to drop the overall size of the tremor by about 80 to 95%, and it would look something more like that by the end.
Amazing. Thanks for the quick demo too.
Of course.
Thanks, Manav. We'll see you around.
Sounds great.
Bye. And now, hey Glenn, we're coming up on Hive.
Yeah.
So Glenn, tell us about Hive and what you guys have built during the accelerator.
Yeah, Hive is a remote patient monitoring device company. What we're doing is we're creating an add-on device to help monitor if and when patients are taking their IV medication at home, because there's a really big shift for healthcare to move from the hospital to the home. But one of the biggest things that's lost is the ability for providers to know if and when their patients are taking the medication correctly. So what we do is we reintroduce some of that behavioral objectivity monitoring. And honestly, that's what we do. We're going for a Class 1 designation because we don't interact with the medication at all, and we don't we don't introduce any additional steps because we want to meet patients where they are so they can just get back to living their life as fast as possible.
Great. Glenn, thanks so much.
You're welcome.
Appreciate it.
Yeah.
And now we're coming up on Nurse Santis. John, hello. Can you tell us a little bit of...
Kim, how are you?
I'm great. How are you? Good job today. Can you tell us a little bit about Nurse Santis and the device that you guys, what the product does and how you've worked on it since being at mHUB?
So Nurse Santis is addressing challenges in age-related balance decline, both detecting when someone's balance is declining and actually doing something to correct it. So to accomplish both of those, we've developed a device that we call Nervesta, which integrates both diagnostic assessment and therapeutic correction to address exactly that balance decline. And our target is to help the 58 million Americans who live with age-related balance impairments that increase the risk of fall-related injuries and make it increasingly difficult to continue living actively and independently. And Nervesta puts an end to both of those problems.
That's great. John, thanks so much. Okay, and here we have Nova Access. So Jonathan, can you tell us a little bit about the product you've developed?
Hi everyone, my name is Jonathan. I'm the co-founder and CEO of Nova Access Biotech. At Nova Access, we're building a smart needle-free drug delivery platform that allows patients to self-administer medications subcutaneously or intramuscularly within 0.3 seconds and track long-term treatment progress. Our value proposition is to simplify the self-injection process and to improve the remote healthcare adherence, making self-injection as easy as making your morning espresso from the coffee machine.
Jonathan, thanks so much. Great job today.
Thank you.
Thanks. All right, and now we're with Nextgen Port. Kathy, great to see you.
Hey!
Can you tell us a little bit about the product and some of the milestones you guys have reached in the program?
Yeah, I'm happy to. So we're working on an implanted smart chemotherapy port that helps cancer patients because we track changes in their blood cell counts and their heart function while the device is implanted in their body. So what we have at our demonstration table is a simulator of blood that's flowing past our optical sensor, and what the optical sensor is doing is counting images of different types of cells. So we can see on the screen the different textures, our different types of cells, and the algorithm is creating a histogram that's showing how many of each type of cell. So we're very excited to be here at mHUB. We had a great day at Demo Day and got a lot of really positive and exciting feedback from investors and corporate sponsors.
Kathy, thanks for sharing. Appreciate it.
Thank you.
Thanks. So here we have Ping. Will, hi.
Hi, how are you?
Good. Tell us a little bit about Ping.
All right, so Ping is a smart wearable for seniors and older adults that really connects them to their families and loved ones, in addition to helping caregivers really understand outcomes. So think about automatic fall detection, GPS tracking for memory care patients that independent living and assisted living facilities can really use to gauge how their residents are doing. But then we also really connect that into families. So imagine that you have mom or grandma who's in a home, you don't know how she's doing, but you can get an alert right onto your phone about wonderful health outcomes. So imagine she hits 2,000 steps in a day, you'll get the notification and you can send her a quick like, a kudos. You can send a 10-second voicemail to say, Mom, I love you, keep up the good work. And we found that really brightens seniors' day and increases that level of connectivity. 71% of grandchildren reach out to their loved ones once a month or less. So really kind of bringing every caregiver into the step to raise outcomes and make healthier, longer lives.
Sounds great.
Yeah.
Well, thank you so much.
No, thank you.
Very cool. And now we're approaching the ProMedics table. Scott, hi. Can you tell us a little bit about the product and what you've been working on?
Sure, Kim. So we have a ProMedics FlowSense, which is a wearable, non-invasive sensor that fits right on the fingertip. And what it does is it measures peripheral blood flow or capillary refill. And that is to determine whether a patient has sepsis or is recovering from sepsis.
Great. Thanks, Scott. Great job today.
Thanks,
See you around.
Kim.
Bye. Hey, James.
Hey.
All right, so now we're going to talk to Willa. James, can you tell us a little bit about what Willa does and what you guys have worked on since being at mHUB?
Yeah, so Willa provides objective fetal pH during delivery, and we combine that with the existing systems that do fetal heart rate. And by combining that information, we can now give doctors the ability to read objective data instead of interpreted data. And this is going to help them determine when and if a C-section is needed. And we've been able to, here at mHUB, produce our fully disposable unit. We've been able to build and integrate, showing that our system works and is fully compliant with existing capital equipment. And we've been able to network to set up clinical studies that are going to be happening at the end of the year.
James, great. Thanks.
Thank you.
See you around. Hello, it's tomorrow, as you can probably tell, and we're going to do this all over again. So the video that we just showed you was all the MedTech teams demoing their product in the shop area. What we didn't show you is the stage where they pitched to the investor audience, the corporate partner audience, and just the general mHUB ecosystem. And they're going to do that again later today, and then jump back into the shop, demo it, and we hope that you learned a little bit about the teams that move through the mHUB Accelerator program, and we'll see you next time. Bye.